Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Yes, good evening. Welcome to our program, the World Community Magazine, coming to you live. I'm Ed McQueen, your host, and my sister April, of course, she's there for support. Today, we're going to get right into it. If you've seen the promo, then you know that we're going to be talking about a unique NASA program that we thought that community needs to know about, and that is going to give the community the ability to explore some options, especially for young people. Since the area, especially the Woodyard County area, it's a magnet for tourism, and these tourism tourists will be looking for unique places to dine, unique appetizers and so forth, and that's just to name a few. So we want to talk about this evening is an opportunity, again in partnership with NASA, about what they call the NASA HUNCH program, HUNCH. I will go into depths of it with my special guest, who will come on to tell us all the advantages and all the opportunities that are out there. Again, we got to reflect on the fact that this is Woodyard County is a tourist area. You know, you got Myrtle Beach and Conway. Conway is fastly growing. So this is one of the parts of the labor market that we think is going to be enhanced by someone having this skill and getting ready to be a good entrepreneur, for lack of a better word. Okay, so while we get on to it, let's start off with my guest, Mr. Lee Moultrie. He is considered, so he says that he is the interim interim president of the Great Charleston's Chefs Association. Now, Mr. Moultrie wears a lot of hats, and the last time he was on our program, he wore the hat of a good, not an expert, but one that could partake some knowledge to all of us regarding the prostate. And I would certainly appreciate that. And now he's at it, or he's probably been at it at the same time. But why don't we let Mr. Moultrie go ahead and tell us about it?
Mr. McQueen, thank you, sir, for the opportunity to speak with you and the audience. I've been in the hospitality community arena for the past 50 years. I started out as a busboy in a restaurant in Charleston in 1972. But after 4 years and being a busboy waiter, I joined the Air Force, traveled for a number of years, and I've been retired from the Air Force for the past 29 years. So then I got back into the hospitality arena again. And we just came back from the Chefs Convention that was held in New Orleans. As I was at the Chefs Convention in New Orleans, I saw some young students from Virginia that had won the contest for the high school. They won the contest for their food to go to the International Space Station. Okay, now understand what the Hutch program that you told your audience about, be it the culinary or hardware. This is some of the programs: design and prototyping, video and design, video and media. Those are just a couple of the programs, but each of those programs are STEM certified. So even the food that these young kids won the contest for to go to the International Space Station, it is not the traditional food that you and I may eat, because the blood vessels of the astronauts when they're in the International Space Station changes. Their whole body composition changes when they're at the International Space Station. So everything that they're doing is different. So the students did that. So once I came back to Charleston, the NASA representative reached out to me and said, Mr. Moultrie, would you be interested in doing the same program in the Charleston area? And then I asked her, had she ever done this program in Charleston? No. Had anyone done it in South Carolina? She said no. I said, well, why don't I bring the 4 other chapters of the Chefs Association we have through South Carolina? Why don't I bring all of them together and they reach out to the school districts that they represent that are in their community? For me in Charleston, that would be the Berkeley County School District, Charleston County School District, and Dorchester County. So I reached out to all of the chapters. There's one in Myrtle Beach also. Said, okay, reach out to your school districts and see whether they would have a culinary program that the students may want to participate in themselves. So
Right.
that's what I did. Because sometimes we get access to certain information, we let it sit on our desk and we don't do anything with it. My objective is that we make sure that all children get access to this information, even if the children are in private schools and if they're homeschooled, but they're able to participate in this program also. Now, I am at an event now at the International African American Museum right now, and you hear the birds chirping. I apologize for that. But I spoke with you in April and said this was the only day I can get this on the air. And the deadline for this opportunity for culinary is Saturday, October the 6th. They extended it. So anyone that would like more information, they can reach out to me and I'll put their school representative in contact with my representative at NASA in Houston. Now, recently, I think it was September 13th, I went to Washington, D.C. because they had the Global Aerospace Summit. And I went there and I saw that NASA was speaking. I went there to meet the representatives that were speaking in NASA in DC, but I also met, pleasantly, surprisingly, the individuals that did grant funding for nonprofits and all for small business owners. So I will be sending more of that information out also because I wasn't aware of that information. So we want to make sure that the communities, the community members, nonprofits, for profits, school districts get access to all of this information. How do you engage with NASA? And so what I ended up doing was connecting the representatives from NASA in Washington, D.C. with the representatives from NASA in Texas, in Houston. So now we have we are leveraging these relationships to make sure people have access to all of the resources they may need to do their programs. We also, in South Carolina, I engaged our apprenticeship SC representative, Mr. Demetrius Smith. So if anyone in your community wants to do the program, we can show the business owners how they can leverage this for apprenticeship program and possible funding also.
Wow. Wow. Yeah, that's tell me, Brother Lee, what is so unique about this program, you think?
What's so unique? How often do you get to sit down and have a conversation with NASA representatives? How often do our students, no matter whatever ethnic background, they get to sit down with these NASA representatives of all at all levels? And one thing that they I remember seeing years ago when, because NASA is one of my favorite channels. If anyone has Discovery Channel, you can go to
Yeah.
channel 332
Yeah.
and you can see NASA. It's 24/7. The unique thing, is you get one of the things that brought out the program I saw years ago was they wanted to let the students know everyone that works at NASA doesn't go up to space. You can come there and be a cook. You can come there and be a mathematician. You can come and do conservation. You can do anything you want at any place in the world. NASA because it's so vast and it's everywhere in the world. It's a global organization. So
Yeah.
that's what we have to tear down these barriers that to think that you can't do that or you can't be there. No, anyone can be there. And if there's any African American that haven't seen the video by the African American astronauts, they did one Juneteenth day last year. And it's, all you have to do is go to YouTube, put in NASA, put a space, and put the color of space. Again, just put NASA, so appear a dash, and then put the color of space, and then you'll be able to see about 13 different African American astronauts, and they're discussing their journey to become astronauts themselves.
Yeah, I got to echo what you say about the things that on the NASA program that's on broadcast on TV or YouTube, whatever. I usually I have that channel, particularly not necessarily on YouTube, but I have that channel. That's one of my favorite, man.
That's
Really, I don't know. I don't talk to anybody about it because a lot of people just are not their favorite. So, I mean, a lot of people. So, and I'm left in awe sometimes. I try to keep up with the new the web telescope,
yeah.
and such things, and know what new things are being brought on by them. But it's interesting, and the reason why I used the word unique a few minutes ago was interesting. That we're talking about culinary now. I know that the food is a unique way of preparing food for NASA astronauts, and it's a reprocessed, so to speak, not necessarily losing any nutrients or anything. My understanding, what I'm reading, but are we talking about students reaching that level of culinary?
Well, to participate in this contest, when you go to the website that I sent you, Culinary Hutch, it gives you the exact recipe on how it has to be done.
Right.
It's not just me going in the kitchen what I prepare for my normal cuisine. No,
Right.
it's identified down there because it's done by a bioengineer, and she and her other counterparts have developed a recipe that the students has to follow all the way around. And then we'll send you the statement of work on whatever the teacher or the advisor is. They'll be able to walk with the students down the pathway to achieve that goal. The American Culinary Federation, we are partnered with NASA to achieve this goal. So the certified chefs will be working with the students to make sure that they're able to execute what they have to do. Now, I am not a certified chef. I'm a professional member in the American Culinary Federation. Okay, we have two different levels in there. Some of the people are certified chefs, some are professional members, as I am, and then some are still working on their certification.
So, how does a place like Ori Georgetown Tech? How do they have a huge? My understanding, a huge culinary program there, especially one in Horry County.
So what you would do then is you would make sure whoever is the dean of that culinary school, you would make sure he or she get access to that information, and you would have that person reach out to me, and then I will put them directly in contact with the NASA representative in Houston, Texas.
Right. Okay.
And that's in any school, even if you have them in or you got the technical school there, that's one thing. But if you have someone in the public school, um, K through 12, we want these students to participate. And if, the one thing about it, if they don't participate this year, just get prepared to participate next year. We want to make sure people start processing themselves and getting ready. And remember, now culinary is not the only one. When you go to NASA Hutch, you see all 8 of the programs that NASA is doing. What we'll do then is whoever Allison is my point of contact for culinary and NASA. What she will do is introduce me to the person who's the video and technology point of contact. Each one of these programs have a different point of contact in NASA.
Right, right. Yeah. Well, it sounds like you've done your legwork. I guess that's why we saw it's so important to have you on, and you were so willing to talk about that. So I really want to applaud you for being such a magnet in the community like that, of propagating information, important information like you do.
Well, I appreciate that, Brother Edward. But along that line, I think what it is sometimes there's so much information out here for all ethnic groups, especially all of us in the working class.
Right.
Sometimes people don't disseminate that information. And then we are saying that we don't have a seat at the table. I mean, because when I went to Washington, D.C. to NASA, the Global Aerospace Summit on September 13th, that's out of my pocket. I had to pay for that. So I went there to get the information that we can share with those throughout the nation. That's not for Lee Moultrie.
Right.
That's for Horry County and throughout the nation, because these children have to be a part of the change we want this world to be a part of. And we want to bring them to the table. We want everybody to get to the table, no matter what ethnic group they are and what gender.
Okay, so now you brought up something that could be interesting. I know that this on the 6th of October, you said is the final day, is the last day for that. What time thereafter that can, for example, we bring a bunch of students to the nearest place that you think could benefit from the information that you were just dishing out?
Well, once we've shared this information, we'll come back together and we'll set up something, because we have the infrastructure within South Carolina. I didn't want to bring this up, but through my relationships that I've had for the past 23 years, and you and April are a part of that relationship, a lot of the folks in the American Culinary Federation have not executed this or have not nurtured this relationship with NASA as effectively as we would want it to be. So I am in discussion on, I just did a discussion with 13 states about a month ago, and 3 territories, be it the Bahamas, Jamaica, and Puerto Rico, to show them we'll set the model in South Carolina on how to execute this, and then we'll show you how to replicate this in any of the states that you are in and or any of those territories. Because we have county government sitting at the table.
Right.
I just talked about the apprenticeship guy for South Carolina. He's at the table. So we also have the employment office at the table. So all of these relationships I have, so all I'll say is South Carolina, who's the counterpart in North Carolina that we can reach out to help the school with funding and other resources? And that's all I'm doing.
Well, you're doing a lot. You're doing a lot. That's all you're doing. You're doing a lot, and that won't go unappreciated. So, Lee, you got what kind of age group are we talking about here?
High school, whatever's in high school, whatever children are in high school. And now when you go to that website, Culinary Hutch, with the NASA one, and anyone go there, you'll see those young kids on that homepage. Those are the young kids I met in New Orleans in July this year. And they're just some nice young kids. They just wanted to have fun. And so long as they're in high school, they know how to, I mean, when you look at the Food Network, you got all these young kids preparing food. So if they're able to do whatever they need to do.
Absolutely.
They kick it. And then the chefs in your local area are willing to help them execute whatever needs to be done also. We'll make sure that happens.
Yeah, you see, I'm planning ahead. I'm trying to plan ahead like that. And I'm just envisioning, taking, vast numbers of young people to witness this and participate and become uniquely involved as much as they can. you know.
Well, the one thing about it, Brother Ed, is when I went to the Chefs Association, this was my first time in a long time. And what I did was I showed them something. I created my business card that they had never seen done. I said, if you're a part of the local Chefs Association, you're also a part of the National Chefs Association. And if you're a part of the National Chefs Association, you're a part of the World Chefs Association, which represents 110 different countries. So when I was in New Orleans, I spoke with the World Chefs president, which represents 110 countries. So we have an ongoing relationship. Also, the immediate past president for the American Culinary Federation in his 94-year history had the first certified executive pastry chef from Summerville, South Carolina, where Brother Ed and April met Chef Kimberly Brock Brown. How long ago was that? Probably 8-10 years ago.
Yeah.
So she was the first certified executive pastry chef that they ever had for president, and the first female and the first African American in 94 years.
Oh, that's unique. Yeah, good to hear though. Good to hear. Um, I wanted to get that age group in there because I don't in our attempt to carry out something like that, which is what I just proposed. I don't want the age to be a restriction there
No,
at any point.
bring everybody to the table who can come to the table, because we want to expose them to this now. And if they have to start planning for it when they get a little bit older, so
Yeah,
but bring
right.
them to the table so they can see these chefs in your local area, and also with Horry County Tech, with those chefs that they have there, those students that have there. I remember taking my daughter to the Trident Culinary School. I think she was about 13 or 14 years old, because she
That-
wanted to be a chef. So I took her over there so she can take a tour of the facility and see what it was. But now she's doing something different. But that was at 13 years old. I took her there. So we must take these children to different environments so they can see, expose themselves to different dreams and skill sets. Okay?
yeah, and she was 13 at the time.
She's
Uh,
13.
Look, she probably saw something and engaged in something that she'll never forget. Okay.
Oh no, she never will. And
Yeah, yeah.
most of the people were shocked because I brought her there. I took her to the unemployment office and said, okay, what kind of course should she be looking at as she's coming through high school now? And so they were like, what? You bringing your child here for this? I'm like, yeah. So I took her to Trident Tech also. All of these different things at 13 years old. That's what I was doing to help me make a pathway for my child to be executing. Okay, not just randomly letting her do something, but exposing her to different things.
Yeah, absolutely. And I passed by when you say Trident. It's from Trident Community College in Charleston, I believe. That's what you're talking about.
Yes, Trident
Yeah,
Technical Community College,
Community
and
College.
they Trident has a culinary school also.
Yeah. Oh, that's okay. All right. So, so Lee, if do you feel that that would be a worthwhile endeavor? I know there's going to be challenges ahead, but to get fully engaged in this and just gather up, if you, for lack of a better word, some young people, some students, and some mentors to make that trip. And
Which trip?
the one that you just said that is either in it doesn't have to be in Houston, but like I said earlier, something that's more local. Um,
But you
and
have, did you say? I think you said you have Horry County Tech with a culinary
yeah,
school there.
right.
So let's start there, and we can see what other resources we can bring to Horry County Tech from Myrtle Beach, from Charleston, from the national office, and or what we can get from NASA to be in here also. So whatever way we can help you in your community there, and you have your city councilman who mentored me many years, Larry White. So you get him to the table to help y'all get the necessary whatever access. We're not talking about money. Let's see, what do we do to get these people, the students together and the
Right.
school districts? Let's do it.
Absolutely. Absolutely. I mean, because again, I think this is really, this contributes to the future, based on the fact that culinary plays such a huge part in satisfying the tourist industry here. Charleston is also now, because of the International African American Museum, I mean, that has boosted its tourist factor there. You agree?
Yes, it is. That's why I'm here tonight.
Yeah.
So it is. So culinary is a beautiful arena, and we want to help people get into that arena so they can learn. We can learn how to better prepare food that is more healthier for us, and we can make some dietary changes. And so that's what we want to educate children about also.
Absolutely, man. Look, this kind of information really, I place a high value on it, and I'm sure April does also, and maybe a lot of people that's looking at it could kind of envision what they could do with the community, and especially young people in the culinary, and they see the impact, the major impact of how it's being played in the county, the PD area, even in Charleston. Okay, again, that industry is going to be huge. Okay, and just because a person is working in a McDonald's kitchen or Hardee's kitchen, based on the trend that's happening now, you have people going out on strikes, man, and demanding higher wages. So when you have that kind of culinary background, you'll have a foot to stand on, right?
You'll have a foot to stand on. You can open up your own business. You can become a private chef, private cook. It's unlimited. Even if you're just preparing food for yourself, like me, I prepare food for myself, and I've done it for the past 18 months. I had to change my diet, so I've done that. Lost 40 pounds, and they say, "Okay, Mr. Moultrie, you're 66 years old, but now that you change your diet, you're exercising more. Your body is performing at a 60-year level." So that's what we want to teach people also. So there's different things that we can look at with NASA. NASA is not just the culinary aspect. It's so many other things, and you'll be able to share on your website the different websites that the people can go to, like NASA HUNCH, where you got all 8 of the programs that people can go to, and you can give them my number. They can find me, Lee Moultrie, on LinkedIn, and I can assist anyone besides you connecting them to me, so they can reach out to you in April, and then we can see how we can help them, no matter where they're at in the nation. With these NASA programs, we can do it. I just helped someone in Washington State last night connect with with NASA Hutch up there. So that's what we're doing. It's all about the relationships and connecting people to those resources for the students. And there's no money being exchanged and none of this. So nobody can think, well, it's a good hustle. No, this is God has just blessed me with having access to the table to help these students, the next generation. So that's what we have to do. Move away from that type of mentality. How do we empower these students and our communities of all ethnic backgrounds?
Yeah.
And I really appreciate the opportunity to be with you tonight, my brother and sister. So if you have any other questions, I'll answer them. But other than that, I'll just pass it over to Melanie.
Marlene.
Marlene.
Yeah. Well, we'll lead into that. Oh yeah, but Lee, before you go, there was a comment that came across the screen a few minutes ago about the question of did you get an opportunity to visit the Air and Space Museum?
No, I did not, because let me tell you something. I flew into DC for one day only, so I had to get up 2 o'clock in the morning to be to the airport at 4 o'clock in the morning for my 6 o'clock flight, and I was in DC all day long. And then I caught the last flight out of there at 8 o'clock. I was dog tired for a 66-year-old man. Because everything was done in one room, so we were
Yeah.
there just there that one day. I was hosted by the U.S. Chamber of Commerce. So as my company is a part of the U.S. Chamber of Commerce, I didn't get a chance to go out. I just built relationships, because that's all I was there. I didn't have time to go on the tourist track. I was there to get resources to bring back to our communities.
Well, man, look, hey, it's been great having you, Lee, and like you said, we're going to blend into now. Um, uh, we're going to, before I bring on our next guest, we want to slide right into it. Um, we're going to offer you some better way of getting insurance for that same program of yours. So we're going to lead into our conversation with someone that you've had the privilege of meeting, and she will give us a good rundown on an update. And this is a very important, okay, because so many people, it applies to so many people, okay, about the different insurance enrollment, Medicaid, stuff like that.
I used to sell insurance many years ago. I think this is a great young lady, and I think people need to pay attention.
Right.
If you're not 65, listen to the information that you may be able to help someone in your family and or your church or your community. This is very, very serious what she is going to convey to you, on especially with the Medicare instruments and anything else. Thank you, brother.
Absolutely.
But I look
And
forward to connecting with y'all soon, and me coming up to Conway again soon.
yeah, absolutely, man. Absolutely. We can't wait to get you here. Got a lot to talk about. So look, you take care, and we'll be communicating, preparing to have you again. Okay.
I look forward to it. Thank you, my brother. God bless.
Yes, sir.
Bye bye.
That was Mr. Lee Moultrie, who's always coming on with very, very important information to share with us on our broadcast. And like I said earlier, before initiating the program, was that the last time we talked with him, it was about the prostate for men, and he had a wealth of information that even I think that that went across different boundaries and different ethnic groups, and it was well diversified. Of course, that kind of information about your prostate it's got to be diversified. But anyway, thanks again to Mr. Lee Moultrie. We want to now go into the question about Medicare enrollment. This is important, okay, because the period is coming up, and the Medicare coverage options that are out there now. And when people see small entities or companies that open up just to do just that and to help you deal with these issues like changes in Medicare beneficiaries, stuff like that, and opportunities about open enrollment, what you can do now, what you couldn't do, like you couldn't do the last time. So we're blessed to have someone with us, as was promoted, to help you with that information. And we'll just go right straight to Miss Marlene Woodyard of Woodyard. Don't look surprised.
Oh, me? Okay.
Yeah. Right. Yeah, he was. Don't look surprised. Miss Woodyard, how are you doing?
I'm doing well.
Doing well. And
Yeah.
To our audience, Miss Woodyard, Miss Marlene Woodyard has one of the fastest growing insurance group in Old Recon, and we're proud of that. And then she's been assisting people, just like it's going out of style. And you've been hearing good things about her. And I'll leave it up to you now, Miss Woodyard, if you want to introduce yourself. to some of the people. I'm sure not just about everybody.
Yeah. Yeah, I'm hoping there's a whole group of people that's realizing how important this information is. So yeah, I'm Marlene Woodyard, Woodyard Insurance Group right here in Conway, 1311 13th Avenue in Conway. Yes, we are coming up on annual enrollment. The Medicare season is upon us, where Medicare actually allows us to take a look at what we have going on as far as our health insurance, as far as our Medicare coverage, and we're able to analyze what the plans, are doing, what changes are taking place, and so forth, and then be able to make educated decision as to what we think we should have, what best meets our needs, and so forth. Just a quick backdrop: Medicare is the federal health insurance program for people age 65 and over, and people under age 65 with certain long-term disabilities and so forth. The program helps to pay for many medical services, including preventative services, hospitalization, physician visits, prescription drugs, along with post-acute care, skilled nursing facility care, home home health care, and hospice care. So it's a very important, part of what we've implemented in our society. People with Medicare may choose to receive their Medicare benefits through traditional Medicare or through a Medicare Advantage plan, such as an HMO or PPO, that are administered by private health insurers. People who choose traditional Medicare can sign up for a separate Medicare Part D prescription drug plan for coverage of outpatient prescription drugs, and may also consider purchasing a supplemental insurance policy to help with out-of-pocket costs if they do not have additional coverage from, like their employer, former employer, union, or Medicaid. So people who opt for Medicare Advantage can choose from dozens of Medicare Advantage plans that are represented in their geographic area. And these plans will include all services covered under Medicare Parts A and B of Medicare, and often include prescription drug coverage, as well as most have additional ancillary benefits like dental, vision, transportation, fitness. So depending on what your needs are, you want to look at the different plans that are available, and then, get a plan that's going to help meet some of the needs that you have. So each year, Medicare beneficiaries have an opportunity to make changes to how they receive their Medicare coverage. And that's during the nearly 8-week annual enrollment period, which is upon us right now. So I just wanted to make sure that, I represent on this show with Brother Edward, and just kind of make sure that people at least have the information. I believe information, education is important. And once you have the education, you can now make an educated decision, right? You can
absolutely. So you mentioned the enrollment period, but you didn't give me a beginning and an ending. What is the period?
The annual Medicare open enrollment period runs from October 15th through December 7th each year. During this time, people with Medicare can review features of Medicare plans offered in their area and make changes to their Medicare coverage. And these changes will go into effect January 1st of the upcoming year.
Oh, okay. And now you may have said this during your overview. You gave a fantastic summary, by the way. But you would have, you may have addressed this already. But the changes that for the Medicare beneficiaries, what are the, give us an update on what's new changes come about during the annual enrollment period.
Well, people in traditional Medicare can use the Medicare open enrollment period to enroll in a Medicare Part D prescription drug plan, or switch between Part D plans. Traditional Medicare beneficiaries who did not sign up for a Part D plan during their initial enrollment period, they can enroll in a Part D plan during the annual enrollment period. They may be subject to late enrollment penalty, though, if they did not have comparable prescription drug coverage from another plan before signing up for Part D. So traditional Medicare beneficiaries with Medicare Part A and B can also use this time to switch from traditional Medicare into a Medicare Advantage with or without Part D coverage. People who are enrolled in Medicare Advantage, which, believe it or not, that amount of people is growing significantly. They can use the Medicare open enrollment period to choose a Medicare Advantage plan that's different than what they currently have, or they can switch over to traditional Medicare. Medicare Advantage enrollees who switch to traditional Medicare can also enroll in a Part D plan, which is a prescription drug plan, if they want outpatient prescription drug coverage. Drug coverage is not covered under traditional Medicare Part A and B. They may also consider purchasing a Medicare supplement insurance policy, which is also a Medigap policy, because there's many co-pays and deductibles that's associated with the original Medicare program. Medicare beneficiaries are encouraged to review their current Medicare coverage during the annual enrollment period and compare other options that are available where they live. Because an individual's medical needs can change over the course of the year and from one year to the next, this may influence their priorities when choosing how they want to get their Medicare benefits. Medicare Advantage and Medicare prescription drug plans typically change from one year to the next and may vary in many ways that could have implications for a person's access to providers and costs. So we want to be very cognitive of the annual enrollment season and realize that these plans are changing, our needs may be changing, our medications may be changing, our providers may be changing. So we really want to take that time to do the review and so forth.
Let me ask you about Plan D, if you don't mind me interjecting this. What are the limitations of Plan D? I know you said it's the prescription and so forth. That's the contents of it. But what are the limits? There must be some limitations there.
Well, prescription drug plans, I mean, they all have, formularies. The prescription drug companies that are allowed to sell Medicare plans, they have formularies, and they carry a certain amount. They all have to carry a certain amount of drugs for specific conditions, whether it's 2 drugs or so forth for a specific condition. But they're, depending on what tier, from plan to plan, one company may have a specific drug in, as a tier 2 drug, while another company may have it as a tier 3 or 4 drug. So you really want to make sure that the drugs that you're on is represented at a, at a costly, at an affordable rate, when you, as you analyze the different drug plans that are available.
So does the government give you a range regarding limitation of what they will pay? What a prescription drug is allowed?
All right, so you want me to go through numbers, right? We ain't gonna go through numbers, right?
You got some cases out there with people who have experimental cancer drugs and experimental this and experimental that, and then the doctors or whatever institution that did the operation or whatever, if one pill costs you $900 and you got to take one per month or something like that, or one every 2 months, is that kind of like out of the realm of what the government is willing to pay?
Well, the government, I mean, basically private insurance companies and pharmaceutical companies are what's really driving the cost of drugs, right? So each company, depending on where they get their drugs from, which pharmaceutical company they get their drugs from, they're going to put, different costs associated. And again, if somebody gets prescribed, an astronomical drug, they could go to and even their doctors have a form that, depending on what drug plan they're in, they could send in and request an exception if that drug is not on the formulary, or if that drug is, let's say, a higher tier drug that's not affordable and so forth. So there's different things that we can do, not guarantees though, because again, these companies are in there to make money.
Right.
And there's a lot of drugs that are Medicare is right now, evaluating and going to bat to get these pharmaceutical companies to lower their costs, because these costs are, for some of these life-saving drugs are astronomical, and they drive people into the donut hole where, they're paying half of the cost of the drug and so forth.
Absolutely.
So there's things that's going around right now, with Medicare and the pharmaceutical companies, trying to lower some of the costs and so forth.
Okay, now a business like yours, you're in business to offer service. I mean, your service is information, really, right? And directorship. You direct the people to certain and give them. You pick the best choice for them based on their situation. I kind of explain to me.
Yeah.
I guess I'm for lack of a better word. Yeah.
Yeah, when people sit in front of me, I believe in, number one, I believe in education, right? I believe in you understanding what your options are. And once you understand what your options are, you're able to make a better decision as to what's going to work best for you, right? So I don't, I'll give people a whole Medicare education, which is what I do for every single client. I'll give them a whole Medicare education, show them how Medicare works, the co-pays and deductibles that are associated with Medicare, the different programs that are in Medicare, whether it's original Medicare or it's Medicare Advantage, go over all of that with them. And then, once they actually understand that, then they'll sometimes ask me, well, what would you choose? What, why don't you, you help me, because it's a lot of information. And for somebody who's never, they've never been in that field, they really don't understand all of the ins and outs of it. So even though I try to educate them and try to, show them, they still want my guidance as far as what do you think would work best for me, right? When I sit down with people, depending on what their situation is, I'm a broker, so I work with all of the majority of the major carriers in my area. So I really don't care what plan I put my clients on. My first and foremost objective is to make sure that whatever plan I help my clients, I guide them towards, it's going to be the best fit for them. Everybody's situation is different. Everybody's needs are different. So once I understand your needs and your situation, I can give you guidance, ultimately it's still your decision which direction you want to go in.
Okay. You may have addressed this issue. Everything you offer comes under the umbrella of being an advantage. So I'll ask the question, how do Medicare Advantage plans vary? Did you address that already?
How do Medicare, so you want okay, so I'm gonna do the features of traditional Medicare compared to those of Medicare Advantage. Traditional Medicare and Medicare Advantage both provide coverage of all services included in Medicare A and B, right? So regardless if you're in traditional Medicare or Advantage, you still are going to get all of your Medicare A and B benefits.
Right.
But certain features such as out-of-pocket costs, provider network, and access to extra benefits vary between these two types of Medicare coverage. So when deciding between traditional Medicare and Medicare Advantage, people may want to consider a variety of factors, such as their health, their prescription drug needs, their financial circumstances, preference for how they get their medical care, and which providers they see. These decisions may involve careful consideration of premiums, deductibles, cost sharing, out-of-pocket costs, extra benefits offered by Medicare Advantage. So yeah, you want to again know what both sides of the equation hold in order for you to be able to, to make a good decision. How do Medicare Advantage plans vary? The average Medicare beneficiary can choose between about 43 Advantage plans. There's so many Advantage plans out there that are offered by about 9 insurance companies. So just so you know, I mean, we may have about 9 insurance companies, but each one of them have 7, 8 different plans that they're offering at any given time. And these plans vary according, across many dimensions. They vary in premiums, out-of-pocket costs, provider network, extra benefits. We've mentioned before, people love the silver sneaker or the fitness program and so forth. So if that's something that you love, you want to make sure your plan has that. Some people need hearing. If that's something that you need, hearing aids are very expensive. You want to make sure your plan has hearing aids included in it. Transportation, some people aren't able to get back and forth to their doctor's appointments, pick up their medication, go get simple things like food. If you don't have transportation, you're at a he
ought to look.
That's right.
It's just shot, man. It's gone.
So if you've decided to go with a Medicare Advantage, you want to kind of make sure that your Medicare Advantage plan has transportation if you need transportation, right? So you're looking at these plans and making sure, because of the vast amount that are out there, and even, we may love one particular company, but again, recognize that that company has different plans with different benefits. So at least do your research on that particular company that you love and see which one of their plans is going to work best for you.
So that's where you come in, right? You assist them.
I help them. That's correct. I help them. I help them make those kinds of, determinations. We narrow down.
Just let me stop. And the reason why I'm kind of dwelling on what your type of operation is because I think if you got a low income group of individuals who may not correlate with adequate education, they may find out that what you're offering to them without even coming in to seek it out, knowing that they will have to pay something. They might refuse to even seek that out. Okay, and they're missing on something like when they do that.
That's right. Well, my clients I don't charge my client. There's no consultation fee, right? You walk in here and you say, how do I get paid? I get paid by the providers. I get paid by the companies that I'm, appointed to sell their products with. Again, because I'm appointed with so many companies, I am not partisan as far as what product and what company I help you decide would be a good fit for you. So you walk in, you pay me no money, you walk out with whatever information and education I can provide you, and hopefully the correct guidance after I've learned about your situation.
You just explained the entire thing right there. I mean, I think a person who is not even aware of a group, an insurance group like you, especially from a certain income, once hearing this, I think that's attractive to them to want to know, say, wow, I think Woodyard Insurance Group can tell me something if I don't have to pay them anything,
Well, hopefully, I have my business has grown significantly, and that's primarily because I care about people when they come in front of me.
Absolutely,
recognize that. And that's the only reason why I'm here, to basically, provide a service that I believe so many people in our communities need. And it would be a shame for people to just, think that they can't afford my services, or that they, she's going to try to sell me something that,
Right.
maybe I don't need, those kinds of things. I want people to be educated. That's it.
Absolutely. Absolutely. That was the premise of my question. And speaking of your growth, we've watched you grow over the years and tremendously, and it's really been blossoming out, and we're certainly proud of that, to be
Right.
associated in some kind of way. So
Yeah.
congratulations on that.
No, thank you very much. And I so appreciate the support, that you guys have provided me always. I will keep plowing forward, and, whoever I see that needs my services, need my help, that's what I'm here for.
Yeah. Now, how does Obamacare, well, it used to be Obamacare, the Affordable Care Act, does that come into play very, very significantly on your decision making of what you offer to people?
Well, Affordable Care Act is for people under 65, that don't have credible coverage with their employer and so forth. And I feel like in our communities, we're missing the ball a lot, because
Right.
there's people running around, young people running around, that think they can't afford insurance. And that's the reason why the Affordable Care Act came into being. And there's people that have pre-existing health conditions that think they will not get qualified for, health insurance, when that in fact is not the truth, because you don't ask any health questions. There is no pre-qualification for ACA, which is the Affordable Care Act. The Affordable Care Act provides a valuable resource it is a valuable resource in our communities, to be able to provide health care to so many people that don't have, other health care, or could otherwise not have afforded health care. It provides a subsidy according to your income, which offsets the cost of insurance. And there's plans out there that are $0, depending on where your income falls, and how much subsidy you qualify for, and so forth. So I think everybody should be looking at healthcare as a right, as a privilege, as something
Right.
that's there available for them.
But I think there's so much negative information that's bombarding them to not even want to seek anything like that. Okay, and that's not fair. Like, I don't.
It's yeah. No,
You can say people are lazy or whatever about not seeking information on it, but they have other things, trying to make a living, and health insurance. When you hear that a person should have health insurance, well, they grew up thinking that they were paying for health insurance.
mm-hmm.
I mean, I always thought that. I always thought that you had to pay for it.
Yeah,
nothing is free.
well,
Okay.
I mean, healthcare, and that's why the Affordable Care Act came into place to begin with, is because of the affordability of healthcare, because private insurers, and because of, in our communities, there's so many health issues that prohibit people from being able to qualify for health insurance. So this, this law came into being to address those needs,
Right.
and it has expanded and expanded. So even though, there's been those that have tried to stop the progress of it, it has become so popular,
Right.
and so important in our communities that they can't stop it. I just want more people to realize that they can qualify for it. They
Yeah.
can get these plans, and the subsidies are increasing.
Absolutely.
There's new laws that have come into being in the last couple of years that really are ramping up on the amount of subsidies that people can get, increasing the poverty guidelines and so forth. So we should really pay attention to that, and go out and seek somebody that can help us get these plans, get healthcare.
You taught a course tonight.
Of course.
Yeah, you taught a course tonight. You dispensed so much information. I don't know anything that hasn't been covered. I mean, you gave in your an overview plus the issues I asked to be addressed. So before we leave, we only got a few seconds here, but before we leave, just want you to explain the Inflation Reduction Act of 2022.
It's broad, but as far as healthcare, it will lower healthcare costs for millions of Americans and put money back into families.
Right.
The Inflation Reduction Act will cap prescription drug costs for hundreds of thousands of South Carolinians. Medicare beneficiaries at that. It will reduce health insurance premiums. People may not know, but Americans pay 2 to 3 times what citizens of other countries pay for prescription drugs, right?
Wow.
Some drugs, U.S. prices are even higher than that. For example, they found out that, let's say Spirivia, which is something that, a lot of people use to control asthma and so forth. In the U.S., it's about $250, where, in other countries like France, Australia, Canada, they're only paying like about $30 or so for it. So Americans pay a lot, and that's what this act is, designed to basically, hone in on. It takes on the problem by allowing Medicare to negotiate prices for higher drug costs.
Wow.
So Medicare is in the process of looking at the drugs that are costing or the highest cost drugs now and beginning their negotiation process.
Right.
Something like Eliquis. We got a lot of clients in my office that are taking Eliquis, Jardiance, Xarelto, those kinds of things. Farxiga, Januvia, all Novolog, insulin. Those are all things that the Inflation Reduction Act is addressing, and Medicare is paying attention and going to bat. With these pharmaceutical companies, they have to lower their prices. Otherwise, they're going to, they're going to get socked penalties and so forth. So, the act is, it's necessary. The law is necessary, and the law it's working. All of it is not immediate. We know that government is, but it is dwindling away what it needs to, so that we can see better options in healthcare, more cost effective, coverages and so forth.
Like I said, I'll tell you, you taught a course here tonight, so this evening, and again, we've had a lot of comments from people on the side wanting to address certain comments, stuff like that. So look, we got to have you back again. Okay, we just run out of time.
You can have me back anytime, because there is a lot of information, and I want my clients to know. And if this is the medium that we want to use for that, I am all in. All right.
Yeah, well, as long as you have information like you just propagated, okay.
I can gather some more.
Yeah, I'm sure you could. Okay, well, look, Marlene, it's been a pleasure, really been a pleasure to having you here to dispense this type of information, and we let the people know that this is the only broadcast that you get that kind of information free. Okay, we're letting people know that WCM Live. That's the only place you're gonna find it.
Well, thanks for having me.
And we've watched all of your staff and your new marketing people doing a great job with communicating. I appreciate all that.
Thank you.
You're welcome. All right, so until we talk again, Godspeed, and continue on with gathering all the information to have for us the next time when you get back. Okay.
All right. Sounds good.
Thank you much.
All right.
Good night.
Good night.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.